The makers of Tylenol reportedly met with the HHS Secretary Robert F. Kennedy Jr. to try and dissuade him from linking the over-the-counter pain medicine to a possible cause of autism. You may have seen some headlines about this in this week. Joining us this morning to discuss the links or potential links here is our health educator, Dr. Griggs. Dr. Griggs, there's a lot swirling around the autism debate this year. It's vaccines, it's Tylenol, there are a lot of theories here. Can you try and cut through the fluff, wade through the water for us here? What should we be paying attention to at this moment?
Pay attention to what has been proved with evidence-based clinical trials. Right now there's a lot of talk. So far there are no scientific links between Tylenol or acetaminophen and autism, and that so far is based, there's no scientific evidence yet until they show that there's an evidence-based clinical trial to do so. One of the largest ones to date was between 1995 and 2021. It was a partnership between the NIH and Sweden. They studied over 2.5 million kids over 25 years, and they could find no causal link. Autism is a very complex neurodevelopmental disease with a lot of genetic links. There might be environmental factors to it, but it's very doubtful that it'll be just one specific thing. So the best thing to do is stay tuned and look for the terms evidence-based clinical trial.
So where does the information come from when we hear the health secretary saying that there is this potential link? Are there any studies that show anything that would tie these two things together?
So from what we've seen, there might be small studies that show there might be a causal link in utero that kids that eventually go on to develop autism, but they're very, very small studies. And there's the large credible amount of credible evidence says there's no link. Now, the thing about clinical trials and data is that everyone has their sets of data, and it's just a matter of the power and quality of those studies. Again, one of the largest studies to date was over 25 years between 2 different countries and 2.5 million kids, which shows the strength of the study and the data that comes from it. So for right now, there's no causal link between autism and acetaminophen or Tylenol, but again, it's just the Tylenol. It's a very complex thing, and there are a lot of genetics involved. There might be some environmental factors, but it's something that's under study right now, and it'll be a while. We'll see.
Yeah, so there's always the thing when you're around a pregnant woman, she's eating for 2.
Yes.
It's like this very nice and cute thing, but there are some restrictions as to what pregnant women can and cannot ingest while they are pregnant. So, should we believe that Tylenol is safe to take if we are pregnant?
Yeah, according to the American College of Obstetrics and Gynecology, according to all the clinical scientific data that's out right now, the credible scientific data, it has been and is safe for them to take with regards to autism. Again, you want to talk to your doctor. I always say talk to your doctor about other medications that might be harmful for other reasons, but for this cause, for autism, there's no scientific link as of yet. Now, there could be information coming out that they're going to release later that will show a causal link, but for right now, there's no scientific or evidence to support that.
Okay, so on the subject of autism, before that Tylenol debate started coming up, or the suggestion that Tylenol was related to autism, we had vaccines, right? We've touched on this on the show, but for anybody that may have missed that, let's run through that as well, because this is another highly studied element here, vaccines. They've been clinically tested and proven over and over again.
They've been clinically tested, they've been proven over again. We're changing the recommendations. We know that they saved millions of lives. But again, the research is evolving because some of the vaccines that we have are brand new. But in order for them to have been administered, they were safe so far.
Okay, so as far as we know, as far as the research
tells us,
no link.
No link, and understand with this report, there's supposed to be more evidence coming out. So maybe and hopefully they'll have more information or data, scientific clinical trials to back up some of the things that are out there now.
Okay, if you are at home and pregnant right now, yes, keep reading, consult your doctor, but all of the research is showing you are okay to take some acetaminophen within,
yes,
doctor's recommendation.
Keep your dialogue with your OBGYN, with your doctor open. Keep continuing dialogue. They've kept you safe thus far. We'll continue to keep you safe.
All righty. Thank you, Dr. Griggs.